find your office. My dentist referred me because I didn't go for a while and there was some maintenance to do and I had this regression on my teeth, very extreme actually.
Right.
So she referred me and within 2 weeks it was, got an appointment here with Dr. Alex and we get it done actually, and yeah, within a month I think it was a big difference and yeah, all went well. I did make a quick decision because I want to get it solved because it's so extreme that waiting longer may even make it worse. So I did some research online to see old technique versus the new technique that Dr. Alex thought about. And yeah, at that point for me there was no need to bargain or to negotiate. I think I just want to get it done, and what I did see was that results were good. And so yeah, it's pricey, yes, maybe it is, but after that I will say it's worth it too. So basically he said that he has this pinpoint or whatever you call it, pinhole technique, yeah. And it was, again, these ones are very extreme, and when he saw it first time he said maybe we have to do two times, but he was pretty confident he can do it in one go. Quite surprised. I told Dr. Alex as well that I was actually willing to work as well when I was recovering, so I could work from home. Actually, I made my office in my bed so I can sleep and recover. So I followed Dr. Alex's recommendation. So that's basically 2 weeks of rest, but you can still talk a little bit. You have to avoid that, obviously. Just no brushing, just liquid food, and then it goes very quickly, the recovery, I will say. Painful? No, after one day I stopped the painkillers because I don't like medicines to begin with, but that means that actually it was not too painful, I would say, but of course different people may have different reactions, but in my case it was pretty smooth, I would say. So, and the third week I think I was already able to eat, to bite some food, so not too bad.
Were you nervous coming into the procedure?
Not really. I've seen that too, right? Just make it happen, get it done, and not so much you can do about it. Just look forward and get over it. That's a good attitude maybe to have. And you're in good hands with Dr. Alex, I would say. And the way the whole team is always enthusiastic, and if things are working out, they're very happy to see that themselves. And also my other dentist, Dr. Ahmed, when she saw the results, she was also pretty pleased. So that's good to see that the team is really helping you basically and wanted to succeed. Very good. I like the people are just passionate about what they're doing, which is good, and they bring it to you, which makes you feel less nervous too. You think, oh, seems they know what they're talking about, and the result is also that they know what they're doing. So and they can always come and call, and they give you a follow-up call to see how things are going over the weekend too, which is very gives you the feeling that you're in good hands. Obviously yes, but because my results are good. Again, I don't know any competition, so for me it was so convenient between the office and here, and it was recommended by my dentist. But I do believe, what I heard and also saw online, that there's not so many of those practices, so it's good to go to someone who's doing that from the beginning, I think, because he's just a little bit further ahead probably than other practitioners that he's teaching. He is in this case Dr. Alex, right? So I would recommend it. Again, I cannot compare it to another, but what I heard and what I read online is that the old one may have been a little bit more painful, or you cannot do it in once, 15, then you have to do it in 3 times maybe, every section. So in that case I think it's good, and it's just amazing that when you're laying in that chair there and you hear them doing all the things through that small hole, and then 2 weeks later it's all filled up. It's amazing actually, it's crazy. I'm not an expert, but from what I see it's just interesting how that works, and it seems like a interesting technique, and the way Dr. Alex talked about put some additional hormones in to make it grow, and the whole combination of the technique and the medication at the day of surgery, that seems to work out. So yeah, I'm not sure why you should go for another one if that is 3 times and recovery takes longer. No, I'm not paid for this session. It's purely voluntary. So just to show that my appreciation for the practice here with Dr. Alex. The procedures I have done, I had the pinhole technique, And Dr. Alex showed me the pictures afterwards. It's just 2 holes and 1 hole here because it's only these 3 sections. And then they seem to be able to move tissue, whatever you call it, from one side to the other, and at the end it's all filled. I was very extreme with my the ones in the corner here, and he was able to do it in one go. And at the end, the dentist had to fill a little bit to make it seal. But it worked out pretty well. So yeah, after all, it was a successful surgery. The patient's still alive.